I'm Matt Willis, Public Health Officer for Marin County, with a COVID-19 status update for June 3rd. We're in the second largest surge since the beginning of the pandemic. Virus levels in wastewater are approaching those at the peak of the Omicron wave in January. Most of us know someone in our immediate social circles that's infected. At the same time, hospitalization and death rates are lower than they've been in prior surges. As we consider our response, it's important to understand what's driving this surge and what's different about it. When I'm trying to make sense of what's happening at any point in this pandemic, given all the uncertainty, I think about two basic things. One is the virus, that is how it's behaving and how it's changing, and the other is us, our human community, and our levels of immune protection and our behaviors. By behaviors, I mean things like mask wearing or testing. The interplay between an evolving virus, our levels of immunity biologically, and our behavior is complex, but ultimately will always determine our pandemic experience. So I'm going to break these down briefly. Right now, one of the most important factors at work is our immune status as a community. When it comes to COVID-19, our immune systems know two basic things. One is whether or not we've been vaccinated, and two, whether or not we've been infected, and of course, when those things occurred. By far the safest path to any form of immunity is vaccination. But those who survive infection do gain some immunity, though they've gained it the hard way. The combination of disease-acquired and vaccine-acquired immunity is called hybrid immunity and is stronger than either form of immunity alone. So what does that mean for Marin? Stepping to a national pandemic frame, Marin stands out for two things. First is very high vaccination rates, and the other is low rates of infection, hospitalization, and death. That is the essence of our story so far, and has countless related benefits in keeping our schools open, our businesses less restricted, and losing fewer members of our community. But this also means that compared to other counties that had high infection rates, a smaller fraction of us have natural or disease-acquired immunity. At the same time, almost all of us have immunity acquired through vaccine, over 95%. And that's protecting us and explains why our hospitals are doing okay despite near record case rates. Now let's think about the virus. The BA.2 variant of Omicron and its related subvariants are driving the current surge. That more evolved variant is better at sidestepping our immune protection against infection. But critically, these infections are not nearly as much of a threat as they would have been last year, when the consequences of being infected were higher, before most of us were vaccinated or boosted, and before treatments were available. So what does this all mean? First, it's increasingly difficult to avoid exposure to the virus, because the virus is evolving to spread more effectively and evade our immune response. For the time being, we should assume we're being exposed if we're out in public. Second, while vaccines aren't protecting us as well as they had in the past against infection itself, we know they continue to limit severe illness, death, and even the risk of long COVID. So what can we do now to protect ourselves? There are four basic tools. First is mask up. If you're serious about not being infected, wear a well-fitted mask, especially with travel and in crowded indoor gatherings. For people with risk factors for more serious illness, including anyone over age 65, a KN95 or N95 mask is especially important. 2. More and more gatherings are becoming super spreader events. Testing is the best way to know if you're infected. It's not perfect, but it can significantly cut the risk for everyone if testing is required before attending any indoor gatherings. 3. If you're at risk for serious illness and you haven't got boosted yet, now is the time. Those who get boosted now have lower risk of being infected over the summer, and summer brings a lot of new opportunities for spread. And 4, if you're infected, talk to your doctor about treatments. You may benefit from a prescription for antivirals. In summary, we've protected ourselves very well through the most destructive earlier phases of this pandemic, and the protection of vaccine remains essential. The virus has evolved and will continue to, and so must our response. We need to stay committed to our layered strategies that are rooted in a science that itself is evolving. Maintaining a balanced and measured response and looking out for each other at every stage. Right now, proper masking, testing, boosters, and treatments are our best tools as we work to minimize the harm of this pandemic in Marin. Thank you for doing your part.